everyone. Today we are going to see a topic is hemorrhoids. Hemorrhoids is a condition. It is also called piles. So hemorrhoids is a swollen veins in the anus and lower rectum. Hemorrhoids are similar to varicose vein. Hemorrhoids can develop inside the rectum called internal hemorrhoids. They also can develop under the skin around the anus and external hemorrhoids. So this is the picture of hemorrhoids. This is external anal picture. The right side is internal anal picture. So now we are going to see etiological factors affects hemorrhoids. The etiological factors means the causes induced hemorrhoids. The causes are the veins around the anus tends to stretch under the pressure and may bulge or swell. Hemorrhoids can develop from increased pressure in the lower rectum due to straining bowel movements or sitting for a prolonged period, especially on a toilet, and having chronic diarrhea or constipations, being obese, being pregnant, having anal intercourse, eating a low fiber diet, and regular lifting heavy items. These are the main reason for creating piles. So we should not give so much of pressure to this region, because the pressure which leads to loosen the muscles and it is brought out through the anus. So these are the etiological factors for hemorrhoids. And we are going to see about the types. There are two types of hemorrhoids. The major one is internal and external. Internal means in this picture we are seeing the internal hemorrhoids. It is occurs only inside in the anus. But in the external hemorrhoids, it starts from inside and it protrudes to the outside. That means we can see in the anal region. So this is called a difference between internal and external hemorrhoids. Straining and constipations. The etiopathogenesis are straining and constipations. Straining for to pass the stools. So that is the major reason. And constipation is due to we took the low content diet. Means low fiber content diet. This is the reason for hemorrhoids, piles. So first we are taking the low fiber diet, which leads to less bulky stools. It can't make the stool semi-solid. It converts the stool into the hardness. So which leads to staining at defecation, which leads to increased intra-anal pressure, which leads to decreased venous return, which leads to enlarged hemorrhoid hull, which leads to venous cushions. This is the etiopathogenesis. Next one, we are going to the clinical features. Clinical features means sign and symptom. The sign means the patient, the healthcare providers can diagnose that abnormality. Symptoms means the patient, they are saying, hey, we can't, I got able to pass the stool softly, like that. So the internal hemorrhoids. Signs and symptoms. There are 4 types of grades in internal hemorrhoids: grade 1, grade 2, grade 3 and grade 4. In grade 1, grade 2, grade 3, the internal hemorrhoids are only in the inside of the anus. In grade 4, it can coming out from the anus like external hemorrhoids. So internal hemorrhoids lie inside the rectum. Patient can't able to view and they rarely cause discomfort. But staining or irritation when passing stool can cause painless bleeding during bowel movements. The patient can notice small amount of bright red color on toilet tissue or in a toilet. A hemorrhoids to pass through the anal opening called prolapsed or protruding hemorrhoids. They may result in pain and irritation. So these are the symptoms for internal hemorrhoids. Then we are going to see about symptoms of external hemorrhoids. In external hemorrhoids, they are also having the 4 stages. First stage, second stage, third stage and fourth stage. In first stage, second stage, third stage are it is as like internal hemorrhoids. It is inside only. In fourth stage alone, it can protruding out from a rectum. So external hemorrhoids, these are under the skin and around the anus. The Symptoms might include itching or irritating in anal region, pain or discomfort, swelling around the anus, bleeding. These are the common clinical symptoms. And thrombosed hemorrhoids, it is one of the type of hemorrhoids. Blood can pool in an external hemorrhoids and from a clot called a thrombus. A thrombosed hemorrhoids can result in severe pain, swelling, inflammation, a hard discolored lump near the anus. This is called thrombosed hemorrhoids. The blood, the small particle of the blood that are accumulating and making the discomfort to the patient. That is called the thrombosed hemorrhoids. So complication of hemorrhoid: anemia, strangulated hemorrhoid, blood clot. The diagnosis of hemorrhoids are three types. First, history collection. Another one is visual inspection. If it is a external hemorrhoid, we can visually able to see the hemorrhoids. Digital examination means by inserting a gloved lubricant finger into the rectum. This allows to check for anything unless such as the growths. So this is the digital examination and through the anoscopy. So treatment is, conservative treatment is, we have to eat a more fiber content diet and soak regularly in a warm bath or sitz bath for reducing the pain and painkillers. The medical management are analgesics, this means painkillers, ointments, creams. These are some of the options for to reduce the pain. And the surgical procedures are hemorrhoidectomy. Hemorrhoidectomy means we can remove the extra growth from the rectum. This is called the hemorrhoidectomy. Hemorrhoid stabling means it can protrude out. So this is one of the procedure. And rubber band ligation, sclerotherapy, coagulation therapy, these are some of the optional surgical procedures. Prevention of hemorrhoidectomy is hydration, high fiber supplementation, avoid straining, avoid long term pressure, means sitting. Thank you.